We used to do this one first and then capitalization, and I flip-flopped them, and I'm not sure if that was a good mistake or not. A mistake or not, I don't know. Okay, so we do the standard protocol. I check the doctor's orders, I wash my hands, I knock on the door, I come in and I identify the client. Hi, my name is Peggy. I'm a psych tech. I'll be changing your dressing today. Could you tell me your name, please? Oh, Frank Johnson. And your birth date, 2/29/42. Okay, Frank. Well, you've had this dressing for a couple of days now. Has it been bothering you at all? No. Okay, well that's good. Do you have any pain right now on a scale of 0 to 10, 0 being no pain, and 10 being just the most excruciating pain you can imagine? 4. You have a 4 out of 10? Well, let me go check to see if there's any pain medication available for you. I'll be right back. I never put it down. It's still up. Oh, you know, I found out that you just took pain medication about 10 minutes ago. Is that right? Oh, yeah, I forgot. Okay, well, you're kind of sleepy, so you have a filthy, dirty nose. That's from all the GT stuff. All right, so let me come back in about 20 minutes and check your pain level out again. Are you recording me?
Mm-hmm. Yes,
Hi! Okay, well, how are you feeling now on a scale of 0 to 10? 2. Oh, great. 0 being no pain. So 2, you're a little bit less in pain. I'm glad to hear that. I think we'll go ahead and continue with the procedure. Now, had he said 3 or 4, I could have said, well, you know, this shouldn't hurt too much. Do you want to continue, or would you like me to check? Because right around 3 and 4 is kind of the barrier of, you know, do we give pain medication or not? Certainly if anybody's a 5 and above, you're going to give it, but everybody's 3 is a little bit different. Where is your pain? You have a headache. Well, let's get rid of your headache before we do this procedure. Why should you be uncomfortable, right? But we can allow the patient to be a part of that decision as long as you don't make it complicated. Well, let me see, a 3. That's not too bad. Do you think it'd be okay if I messed around here and, you know, change your thing? Yeah, I think I can deal with that. I'm not messing around. I saw that look. All right, so I've introduced myself. I've identified him. I'm going to be changing your wound dressing. You've had it changed several times, once a shift, and now I'm going to pull for privacy, right? Now I'm going to put some disposable gloves on. And so, Mr. Johnson, have you had any visitors lately? Your wife, huh? Good, I'm glad she came to see you. Would someone take that sweater off there, please, and put it up on the... Okay, I'm just moving the bed to make it a little more comfortable for me. In fact, I think even a little more. What are we laughing about? You can put it up there. Now, because I'm going to be dealing with possible blood, I'm going to use this red bag, and I'm going to do the same thing we did with it on the with the clear bag for catheterization. I'm going to make a little garbage area at the end of the bed. I don't want to do it yet though, because I got to move these covers. Okay, and if he was cold, I would cover him. All right, but for the sake of us, for the sake of us getting things done, he's not cold. Some of these bags are huge, some of them are tiny. You don't need a huge one, you just need a small. I'm going to put this bag down here just to kind of collect my items. Now, I'm going to check your wound now, okay? I'm glad you're feeling better. Just relax. I'm going to put your head all the way down. One of the things that we don't want to do is we don't want to freak out the patient by having them look at the wound, all right? So you'll notice that right now my primary goal is to remove the old dressing, get rid of it, then I'm going to clean it, irrigate it, put a new dressing in. So I have to pay attention now to what I'm taking out because I have to put back in approximately the same. One of the things that you need to start realizing right away is that every time you use tape, you should fold it over. I was going to show you this on the Elmo, but in order for people to be able to pull tape off more easily, if you fold it over 1/4 of an inch, then it'll be easier. Now that did not happen here, so I'm going to have to, and tape can actually hurt people's skin. Oh no, somebody did it over on this side. If the tape is folded over, it's all the easier for you, but it could still hurt the client. So what we recommend you do is with one finger, it's hard for you to see, I'll do it over on this side next to you guys, okay? Push down on the skin and with the other finger, pull up on the tape, okay? And don't rip it like Grandma used to, you know? Just nice and slowly. I'm pulling the tape off now. I hope that this doesn't hurt too much. Be over in just a second.
Tossing the skin or like
Pushing it down.
pushing it down?
Yeah. So you're actually aiding in the tape coming off. And I might even do this before I put my gloves on, because this upper, yeah, in fact, this one didn't get folded over, so it's hard to grab. Grab them first. You see how I had to use my fingernail, but if it was in fact folded over, I'd be halfway done now. You understand? Yes?
Yes.
Okay.
You know, and elderly patients have fragile skin to begin with, and so if you're trying to scrape with your nail.
Doesn't the AV system work?
No?
No. It worked, yeah. It worked on Friday when I tested.
I know. You're more than welcome to give it a shot. We couldn't get it to go. And I think that the bulb on the Elmo blew out too.
Because there was like a flash.
There was a light and then it flashed.
Okay. An easy fix.
Lovely job, Miss Peggy. Lovely, lovely. All right. So what I was saying to you guys, with one hand, I'm using my non-dominant hand. I pull up on the tape, and on the other, I push down on the skin to help so that it doesn't hurt. Almost done here. Just pulling this tape. This kind of tape doesn't hurt as much as other tapes, and they've really made huge improvements. All right, now I got part of the tape off. You can see why I might do this without my gloves. All right, got one more section to do. You want to start that for me? Please. Yeah, we would love to have it. Thank you. All right, just one more. All right, so I've loosened my tape. Now I have a choice right now. I love tape. I have a choice. Yes, all over. I can open it this way, but I'm not going to. I'm going to open it this way so that he doesn't have to see all the blood. So I am making it more comfortable for the patient. And I look at this and I smell. Okay, and I note that there's just a little bit of serous on this. All right. Now, this is not sterile. You see how I hate gloves and tape. Here we go. Now these could have extradate on them too, couldn't they? So I'd be looking at these and I'd be picking them up. Now what would happen if it's stuck? I would use some of my sterile saline solution to loosen it, okay? And I'm looking at this. Okay, not too bad, and I'm taking note. And I'm looking at this, and I'm kind of protecting him a little bit. All right. Now, I'm going to remove this inner packing. This packing in here is packed with gauze for a reason, okay? Anybody know the reason? Oh, his hand's up for the camera. Yes?
I forget the term, but when like you pull it out, it like takes the excess
Skin out.
That's right.
That little
Debris.
Debris. Is it debris or debride? I always... Debride? Debris, yeah. So what happens with gauze tape is some of the old exudate dries up and sticks to the tape, and that's good for healing. It's good for healing. So I'm going to start taking this out, and this will be quite colorful, and I see I have one. And I'm going to take this out, and if once again, if it gets stuck, we just use a little bit of liquid. Okay, and I'm checking this out. I've got two. Okay, so I have two. It was packed with two gauzes. Now I'm going to say, okay, just a minute now. I need to get some things ready. What's the time to do? Change my gloves. These gloves have been around too much tape, number one. They're sticking together. But then they've also got this bloody stuff here. Okay, so hold on just a second. We're going to do the next part of this procedure. Yeah? Not interesting?
I turned it on Friday, focused it on that, and was perfect on Friday.
Yeah, I know.
There's something loose in here, I think.
There must be. All
I'm
right.
sorry.
Okay, so I disposed of the dressings in the proper receptacle. Now, Mr. Johnson, I need to have you help me. I need that pillow, please. And this is where whoever's checking you off will help you. Could you stand and help me, please? And I'm going to stuff this pillow underneath him so that he's at an angle. Just stuff it. The reason I'm doing that, and it's so much harder with these mannequins, you know. And then I'm going to put a blanket, a waterproof pad down here, shiny side down, because I'm about to clean it. And this didn't get turned very far to the side, but enough. And the reason I'm doing that is because of gravity. Did anybody see that movie yet, by the way? My ear, I can't wait. So anyway, because of the gravitational flow now, as I irrigate this and clean this, the water should fall down onto this pad. But I'm also going to have my towel right here ready. All right. Okay, now I'm going to prepare my equipment right now, so hang tight for just a second. I'm going to turn my back on him, or at least I'm moving away, so I'm going to move this up for a second because I'm not comfortable. I'm moving over here, I'm reading my materials. Now what we have here is we have this measuring device, and these are, normally they're very, they're consumables. You just throw it away after one use, okay? And then we have our Q-tips, or what they call sterile cotton-tipped applicators. All right? And I'm going to start opening some of this stuff, start getting it ready.
Without sterile gloves.
I don't need to have my sterile gloves yet, do I? Because I haven't touched that. All right? All right. My water, I'm going to look at the label and make sure that it's not expired. And this water usually lasts 24 to 48 hours, so I'm going to write on it the date, the time, and my initials. The date, the time, the initials again. The date, the time, the initials. You. The date, the time, the initials. And I'm going to have my hand cover the label because, so I don't spill anything, okay? All right, now I also have my, my little irrigation kit. And this is sterile, but it's the inside of it that needs to remain sterile. So I'm going to flip this over, and here on the floor, fill my sterile towel, but I have another one. Some of these have a sterile towel with them, some of them don't. All right? So I'm going to get this, and I want to talk to you about this before we continue a little bit. Like any syringe, there are parts of it you're not supposed to touch. All right? You're especially not supposed to touch this part, and these little lips here are meant for you to hold on to, all right? So that in a few minutes when I sterilize it, I'm going to put my fingers like that, all right? When I sterilize it, when I irrigate, all right? Now what I will have done is, unfortunately, we are faking it because we can't put any water on our individuals. So I'm opening this up, putting the cap this way, and I'm going to put about 60 milliliters of liquid in here. Glug, 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 glug. All right? Now I can put my syringe back inside of there, and everything in there is sterile, correct? So I'm not going to want to touch the outside of it because it's been inside the solution. I'm only going to want to touch these little things that help me hold it, these little levers. And I'm not going to want to touch inside of here as well. Now I've got my water in here, and I'm doing this before I put my sterile gloves on. All right. Okay, I'm going to make my sterile field now. I don't need my water anymore because I've already glugged it. All right. All right, now I need to apply my disposable gloves again. Okay, I've got my solution. I've got my cotton tip applicators. Now I'm going to have to start opening these, aren't I? Just open these. Yeah, I won't put my sterile gloves on until I actually do all those things. Help me out here. I need
It's
it.
outside of the package,
Right. Now, this is a step that many people forget to do, and we learned what auscultate was, and we learned what palpate is. These gloves are all you even get them on. And what I want to do now is I am going to palpate the edges of the wound. Okay, Mr. Johnson, I'm going to be touching you, and I want you to tell me if it hurts. Oh, it's kind of inside out. I'm going to touch the outside of your wound, and you let me know. I'm feeling for swelling. I'm feeling for heat. I'm feeling for distension. Okay, palpating here.
And of course, if it's tender, he'll let you know.
Let me know if anything is tender. Well, that seems fine. You seem to be healing quite nicely. If I notice any redness in an area, what I would do then is I would refer to that in my recording, all right? And I'm just going to kind of check it out and look at it on the inside. So I've palpated.
Irrigate.
Now I'm going to irrigate, so I've got this ready. It's not sterile on the outside anymore because I've already touched it. This is where we make noise. And we go, first of all, we have to pull it up. What I want to do is I want to clean this wound. I use as much saline as I need on this. And here's where we go. Swish, 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 swish. And then I pat a little bit of dry. Swish, 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 swish. Then I pat a little dry. Oh, looks like I need some more. Still not sterile, so if I need to pull up more, I can pull up more. If I need to pour more, I can pour more. When do I stop? When the water flows clean, okay? Because depending upon how much dried up exudate is in there, is going to depend upon how much comes out. Now, I may have a pool of water in there now. Deep breath. I may have a pool of water in there, and I'm going to get that later if I do, not to worry, okay? So now I've got to get my cotton tip applicator, and I'm going to check for tunneling. This is sterile because it never came out of the bag until right now. When you check all of the surfaces of this by poking. You poke along the sides, you poke along the center, you poke one direction, you poke another. If there have been any other tunneling before, you'd want to go straight to that area. All right. Okay, I don't feel any tunneling, but I have pulled up a little bit of the clear exudate now, haven't I? And the water that was in there. I'm going to get rid of this. I don't need that anymore. And now I'm going to record my findings with my piece of paper and pencil. There it is. Okay. So, do I need to measure? Yes, I got to measure. Here's where I'm going to use this. Still not sterile. Preferably you don't want to place it on top though. And I'm going to use the outer straight edge here. And I'm going to see that the length, which goes first? Okay, the length is 14. The width at the largest space is 2.5 centimeters. So I'm going to go 14, 2.5, and I don't have to write LW, do I? But I got to do the depth. How am I going to measure the depth?
With your sterile Q-tip.
With my sterile Q-tip, you smart aleck. All right. I am going to go down and measure the depth in the deepest part. Put my finger there, and then come back over here and measure it. And that's about 2. Okay? Dirty. So all I've written on here is 4, 2.52, but I know that that's length, width, depth. Later I can go back if I want to put a slash in between them so that it means something to me. Wonderful. Done with this. Okay, so I have irrigated, I have measured, I have palpated. Don't forget the palpating. All right? I think I'm ready to set up my sterile equipment. Don't need this. Finish with this. We do reuse those here in the lab though. All right, so hopefully there's a corner here I can touch, but we have the outside corners, don't we, that we can touch. See a shiny side? I don't see a shiny side. I'm gonna place my bowl here. Now I'm gonna need tons of these. All right, there's 2 in a package. I need 2 for packing. I need 2 to lie on the top. I need 2 for cleaning and 2 for drying. So I need 8. So I need 4 packages of these. And then you know what? It's always nice to have an extra. Because before I put my gloves on, I got to get these things on the sterile area. There's 4. Is that 5 or 4? It's 5. I've got to get my abdominal pad opened up. And I don't think I'm going to need any more of my Q-tips, but you know what? I'm going to open some anyway, just for the heck of it. Just so I make sure I have what I need. Because once I get those gloves on, it's all over. Okay. Sterile gloves, where are they? Here they are. You have to put your, thank you, yes, I'll go for large. All right, so before I am going to have to use some more of this. I can open this same way we do a package, outside first. Yeah, I do too. I see a problem. I love y'all.
Maybe you
Poof.
should have put that.
I should have opened that first. Yeah, good point. Now, I'm going to have a couple, I'm going to put some moisture in here because some of these things are going to have to be wet. So glug, glug, glug. Not a huge amount. Now I can put my sterile gloves on after I put this. Okay, I'm almost ready, Mr. Johnson. Sorry that took so long. I've got these 29 Hanyaks watching me. I'm actually kind of nervous. All right. And, let me see. I think I'll try a large pair today. How am I doing? Have I forgotten anything? Zaltec.
I think so.
Okay.
Now, do they have this loose bowl thing?
No, they're on all the setups. See, they're on the measuring devices.
Oh, they don't have
Oh, no.
former kits we used to use.
Oh, no, I disagree.
Because they're not gonna have that bowl out in the field.
Well, that's true. All right.
You don't have that.
That's right. Yeah, you can check it out.
Yeah, you can get them.
They,
But usually the
Thumb on
kit is
right.
full.
irrigation.
I'm going to move my ring around.
It doesn't have that, but
Above my waist. Just caught myself. Come on, come on, come on, come on. Got 2 going into 1. Sterile, sterile, I'm good. All right. Not even going to worry about that. All right, so now my job is to clean it, dry it, repack it, and cover it. All right, So I know I'm going to have to put a couple of them dry inside, and I know that they have to be spread out. So now that I've got my gloves on, the first thing you always want to do when you get your gloves on is arrange your materials. All right, because they're not necessarily where I want them. And as you know, I already made one big mistake by not opening that bowl first. All right, I'm going to separate these. I'm going to open up my abdominal pad just to make sure it's in good repair. It looks fine. It's the last thing I used. I'm going to separate these. And I'm going to put a couple of them in to get wet. 1, 2. Yes. What's next?
Miss Peggy,
Yes.
is the wound still flooded?
Pardon me?
Is the wound still flooded?
A little bit.
All right.
Yeah. So that's probably what I... Now we make a wonton to work on these, okay? It's our new term, medical term. All right? What?
Wontonize.
Wontonize, yes. And I want to, first of all, I want to get any excess fluid that's on the inside. All right? All right. Now I want to clean it. Wonton again. Starting at the outer edge. Let me know if this hurts. This is wet, okay? One direction only. Another wet one. And it's okay to put a little pressure on there. Okay, oh, I think I need some more wet. Let's go ahead and do a little bit more. I'm touching the client, and the client has its own flora and fauna, and then it's being touched to this. So I'm going to go ahead and clean down the center of it one more time because I'm going to get a little bit more exudate out. All right, throw that away. Now I'm going to dry, same way I cleaned, making a couple of wontons. Dry 1, dry 2. Yes,
Do you want to do a sweeping motion or?
straight down, top to bottom. Now there's a couple of ways, these are clean. Aha, I knew I needed those for something. There's a couple of ways you can pack this. I'm ready to pack it now, and any excess moisture that's in there will just adhere to the gauze, all right? So if there's a little moisture left, it's no big deal. But you want to start at one end, and you can use either side of this to help you stuff it. And you can use your fingers. And what you want to do is you want to cover all of the area that is yet to be healed, because you want all of it being covered so that, oops, this is the other one that's split apart. There were 2 left in it. If I feel like I need 3, I'll put 3, and I feel like I do because I'm packing it pretty tight. So I'm going to go ahead and I'm going to put 3 in it, and I have to remember that for what reason? Documentation. I found no tunneling. All right. Now I feel like it is well covered. I'm done with that, and boy, I hope I have one more. Sure don't. Use too many just to prove to you you needed more. Would you open up one of these for me, please? Improvise, you know. Thank you. Nope. So I need one. We call this the helicopter. We just drop it. However it lands is perfect. Drop it. Now I'm ready to put my abdominal pad on, and the colored line goes on the outside. Now my sterile technique is done. Okay? I don't have to worry about sterile anymore. In fact, the first thing I'm going to do is go. You know, just because it's what you want to do. You just want to make sure it's all there. I'm going to take my gloves off because next I'm doing tape. Okay, well your wound looks like it's pretty good, Mr. Johnson. I think that you're healing up nicely. Dressings like this are usually only kept on for 2, 3, 4 days at the most because the wound actually needs air. So now we've got our abdominal pad on there, and I need to find my tape. And some people do their tape beforehand and they put it on here. I don't. I don't know how much I need until I get to this point. I have flipped it down. I'm going to start with the top. I want to make sure I go over the skin at least 2 inches on each side, or approximately 2 inches. I'm flipping it over 1/4 of an inch to make the next person. I need to be very careful of pubic hair. I see I put this down a little bit far, so I might be running into pubic hair, and you want to make sure not to tape over the pubic hair. Now, one more very important thing. What might it be?
Date and initial.
Okay, what is the date?
21st.
10/21, my initials, and it's 9 o'clock. That way, if this has to be changed once a shift, let's say it has to be changed once a shift, what if the AM shift didn't change it until 2 p.m.? You're not going to go in and change it at 4. You're going to wait toward the end of your shift. So, because we don't want, 2 hours to have passed, we want more like 7 or 8 or 9. Well, 7 or 8 would be better. All right, well, that's looking pretty good. Now, I'm going to move you back to your regular position. Am I forgetting anything else particularly? Okay, and let me move this out of here. Everything's looking good. Now, what I need you to do, it really works well if you have a good, drink lots of fluids and make sure you have plenty of protein. That helps with the healing process. And if you feel like the tape is coming off or you're feeling in any pain, please let us know. Otherwise, I bet they're going to take this off in the next day or 2, and then we'll want it open up to the air. Do you have any questions? No. Okay, you slept through the whole thing, huh? All right, works for me. How would you like your head of your bed? Okay, any questions? All right, we're done. I did patient teaching, right? The patient teaching, let me know if you have any pain, let me know if it comes loose or